We had a client who was referred to us who was a teenager, and she was not gaining weight properly. And people were wondering, why is it? What's going on? Why isn't this young woman gaining weight? And as one of our staff went into the home, we found out that she lived with her mother and father and siblings. And her father worked, but he was low income. And the whole family was not eating adequately. So basically, she was not getting enough food to eat to have herself grow properly during her pregnancy. So our staff member really had to look at the resources that were available in the community to help not only the client, but her whole family.
A mother of ours that had a very low birth weight baby and had also had several other children, and then they were having issues with trying to get somewhere to live. We worked with the mother, or actually our family care coordinator continued to work with the mother after she delivered the baby, and the mother eventually was able to get her GED. She went back to community college and got a degree at the community college, and actually entered another school, another university, and now actually is a former staff member of our program.
A young mother who, at the age of 17 years old, her mother committed suicide in the presence of her younger twin sisters. And in the suicide note, she had asked that she would resume responsibility for taking care of them. Of course, being in the house at the time of the suicide, it was really traumatic for the entire family. Our project really coalesced around her with the various resources that we have, in addition to working with other community agencies to really get her what she needed. And one of the things that we were able to do successfully, she turned 18 during this process, but she was able to get custody of those twin sisters. And in addition to getting the custody, she was able to get respite assistance. And of course, our nurse and our social worker worked with her continuously, the licensed mental health person. I think we're so proud of her the most because she showed so much maturity and resilience. And just with some assistance from us, that young woman completed her GED. She became manager of a McDonald's that was in her community. And she had a healthy baby, and they both are doing really well.
I believe that that bond and that friendship that develops through the trust that each worker has with their participant has really helped change lives and in turn save many babies in our community from dying.
I think Healthy Start changes lives because by being focused on healthy pregnancies and healthy birth outcomes, Healthy Start simply makes brighter futures possible for families in the vulnerable populations that we serve.
Not only does it work to help mothers become better parents, mothers and fathers in many instances, but it also helps to build up a sense of self-esteem within the young mothers themselves, in that they determine that they want to do something with their lives. Some want to go back to school, some want to complete high school, some want to go further, college, be it 4-year or 2-year colleges, or join the military, but they have a sense of purpose and talk about doing things to improve their overall quality of life.
The largest success is to actually see many young women go back to school, get their degrees, become a sufficient parent, and to actually become a role model for many of the women in the community and young parents in the community, and to actually have an opportunity to see that their children have the same opportunities that they wouldn't have had if they had not been associated with these programs that's initiated by Healthy Start.
But we've had some really high success across the country with the disparity between our blight babies and other babies dying, decreasing, closing that gap. So there's been some good clinical outcome. And we really do serve, I think, as a mentorship type association that teach people and show people how you work within the community that you serve and get them to maximize their potential and get them to start making those real life changes for themselves and taking charge of their lives for really good health outcomes.
I think the work that we're doing now is going to be very important to the infrastructure of what's happening nationwide with maternal and child health programs. I think in the next 10 years we will probably be like the president is for the United States. We'll be the one that you look to for guidance, assistance, help, resources, for all of those who are in need. So I think in 10 years we will be the milestone or the pillar of resources for maternal and child health programs.
In 10 years, a National Healthy Start Association will clearly be at the forefront of the discussion around family strength. It will lead the dialogue on maternal and child health and broaden that to how we strengthen our families, how we strengthen our workforce, and how our children are incorporated into the mainstream of our health care delivery system.
I see Healthy Start as a fully authorized program, not having to go through the reauthorization process. I see Healthy Start as a cornerstone of the maternal and child health discipline. I would like to see it become a core service across the entire country. In any of the territories or areas of interest for the United States. I think that the services provided through this program can be replicated and should be replicated in every state of our country.
I would hope that the United States would be saturated with the knowledge of Healthy Start and remembering that life is important and precious and you only get one chance at life.
En 10 años, el programa de Healthy Start todavía va a estar aquí ofreciendo esperanza. In 10 years, I think that the National Healthy Start Association will still be here offering hope to families across the country.
I hope that 10 years from now that having opportunities for infants to be born healthy and to have the things that they need to strive and be productive citizens continues.
Getting name recognition and getting a brand, so to speak, of a program that is recognized as doing positive things for people, making positive changes, and that this is truly a program that is committed to keeping babies alive.